It's a vast area. The Murrumbidgee Primary Health Network stretches over 140,000 square kilometres, serving almost 250,000 regional Australians. Its aim is to increase the efficiency and effectiveness of health services, particularly patients at risk of poor health.
We know that people in regional and rural communities experience poorer health outcomes than our city or metropolitan counterparts, and it's important that we work with a range of stakeholders, including consumers, community health professionals, our local health district and other agencies to really understand what those health needs are.
Murrumbidgee Primary Health Network was established in 2015 and continues to develop a comprehensive understanding of the Murrumbidgee communities it serves. Its ability to do this so well is thanks to the partnerships it forges.
We know that partnerships deliver transformational change, and that's really our focus, working towards a joint vision for the region.
The Murrumbidgee Local Health District is one of those partners. It's a unique relationship and allows collaborative work to foster positive mental health outcomes. The relationship has taken time to develop, but has established Murrumbidgee Primary Health Network as a health leader.
We were very focused on delivering health services by facility, by town. And we've really changed our thinking with our senior leaders now around thinking about how there are gaps in our system and where the health needs are. So by that joint health needs planning, we now think about delivering services where they're needed across the network and across the whole organisation.
One example of the partnership's benefits is the Mental Health Drug and Alcohol Alliance. Over the past 4 years, this dedicated group of the region's service providers has collaborated together to improve mental health and drug and alcohol outcomes for the people living across the Murrumbidgee region.
Innovation's our key. In Murrumbidgee, both the Primary Health Network and the Local Health District absolutely see that being digitally enabled is part of our future. So much of what I'm proud of is the fact that we are using telehealth and technology to get over that geographical diversity that we have to traverse to provide services, and it is indeed our future.
Dr Jonathan Ho is a mental health, drug and alcohol GP and works as a GP liaison for Murrumbidgee PHN. From a clinical perspective, why is collaboration between the services so important?
I really like to think that collaboration and working as one as vital for a patient's well-being, simply because if you have a united front, then we're all geared towards helping the patient on their journey.
With the help of a grant from the Murrumbidgee PHN, Coolamon personal trainer Serinah Maddox runs a popular fitness program. It's a physical workout which brings like-minded people together and provides an outlet for community members, some of whom have been hit hard by drought. It's all part of a Murrumbidgee PHN program called Empowering Our Communities.
People are coming for the social aspect of it and the mental health benefits rather than just the physical benefits.
With the recent effects of the drought across the region, it was really important that we responded very promptly and ensured that those people who needed support in our region were able to access that quickly.
The benefits of such integrated community partnerships extend well beyond exercise. The Rice Growers Association, for example, is also reaping the benefits of Murrumbidgee PHN's push for collaborative partnerships.
In my view, this has been an outstanding initiative where I've seen things happen really quickly and provide practical, real needs for people on the ground, whether they be by mental health first aid or supporting people to attend meetings. The Women in Rice initiative that we have, people attended that, and there were speakers that were providing real practical advice on how to manage and deal with stress.
The many partnerships Murrumbidgee PHN has worked hard to foster over the years means it's well connected to the right organisations. It means programs and initiatives can reach the right communities.
Wagga actually has very high rates of domestic violence. We have domestic violence rates that are 29% above the state average.
The Wagga Women's Health Centre, which helps domestic violence victims, is another partner. Funding from Murrumbidgee PHN helps the centre operate a telehealth line, informative webinars about topics such as trauma, and the well-kitted out centre itself, which offers practical help such as handbags containing life's necessities for women in need. The funding also helps run support groups, such as this one, where the women learn how to play the ukulele.
It is absolutely vital. The support that we get from Murrumbidgee PHN absolutely enables weekend services to happen, so after hours, which includes Saturdays 12 to 7, Sundays and public holidays 9:30 to 4:30. We absolutely would not be able to do that if it was not for the PHN.
It means that people are able to access care closer to home when they need it, and I think that's the most important thing.